Hello, everyone. It's Matthew McKenzie here again. I raise awareness of unpaid carers, especially when it comes to those who are caring for someone living with mental ill health or cancer. Another thing I do also is I'm highly involved when it comes to combating racism, discrimination. First-hand knowledge of that type of thing. And to be honest, it is a problem in the mental health system. So in this video, what I'll be going through is at least some of the main terms that I suppose staff who work in the mental health system or carers or caring for someone from minority groups using the mental health system or even patients themselves. And to be honest, I've got to put my hands up on this one. Most of this presentation will be actually focused on the acute settings, which will be your general hospitals. But in most terms anyway, a lot of the terms and definitions will still apply in regards to the mental health system. Um, so really what I'm going to cover, as I mentioned, is I suppose between, I'd say 12 to 13 terms. The first thing I suppose most people would notice anyway would be the focus on discrimination or bias, but there's a lot more really on what those terms are. And when people think of inequalities and minority groups, they tend to lump everything together and just say it's woke. Uh, and that's something I will cover the problems regarding, and I think that's almost another um, racialized term, actually, to be honest. Fairly new one. Actually, it was released around in the 60s, but I think it's become more, unfortunately, racialized. But when it comes to inequalities, racism, discrimination, it's a complex issue. It really is. People who even have racist terms against it, they might not even realize that they themselves are actually being discriminated against. They might just not know it. But going away from that, let's let's start these terms, and I'll also give examples as well, just in case people think, well, okay, we understand what bias means, but how is it applied in a certain healthcare settings? So all these terms I'm going to mention anyway relate to healthcare settings. So we're going to start with the most common one, which is discrimination. And basically, what does that mean? Well, and I said this is healthcare settings anyway. So it's treating those who use either be healthcare mental health services unfairly based on race, ethnicity, or in other factors. And because of that, because someone is treating them unfairly because of those characteristics, they may take the decision to provide inequitable healthcare outcomes. Therefore, patients from those backgrounds, from those categories, will suffer because of that. To give an example, a doctor refuses to provide the same level of pain management to a black patient compared to a white patient, assuming they are exaggerating their pain. Now, I suppose with this example, it relates more, I suppose, to mental health setting because there is forms of discrimination, especially young black men, where unfortunately healthcare professionals assume that because a black male is acting in that way, it's to do with a mental health crisis, when clearly it may not have been that situation. Discrimination obviously is a whole complex set of characteristics and examples. I'm just giving one of the main ones. It doesn't have to be between black and white. It could be between Asian or black. It could be between Indian or white. It could be white against black. But remember, when you look at discrimination, it tends to obviously affect minority groups more. So I'm focusing on the minorities, hence obviously black population. So that's your form in a nutshell. When it comes to discrimination, the doctor refuses to provide the same level of pain management to a black patient compared to a white patient, assuming they're exaggerating their pain. And there may be many different reasons, and it's certainly not good as to why a doctor is acting that way. So that's our first one, discrimination. If you move over to the next one, exclusion, what does that mean? And then I'll move on to the example of that. So this is the act of marginalizing or leaving out certain racial or ethnic groups in healthcare decision-making policies or access regarding health services. And let's have a look at the example of those things. Hospital board, hence those who are as leaders, make these policy decisions without including representatives from marginalized communities, leaving out voices that could advocate for better access to care. One of the worst forms when it comes to inequality terms. So therefore, they're excluding marginalized communities, and it's not just doesn't just end in there just because of exclusion. It can actually end in distrust, because if those communities are receiving healthcare from the board, the services are not tailored to those marginalized communities and don't perform well, obviously those communities will not put themselves forward to give their voices on what could change. So you have a whole history of distrust because of exclusion, which makes it harder for communities, marginalized communities, to trust, especially if new policies come into place to include them. They're going to feel there's something not quite right and distrust the hospital board or those leaders who make those policy decisions. Another thing, if I want to quickly add this, is forms of education. There's a lot of jargon in healthcare and mental health. We can't just assume that marginalized groups or communities know what to put in those policies. I do feel that, yes, we need to hear those voices, but they also need to be trained as well in order to hold to account and say what's needed in regards to services they receive. So I just thought to add that bit in here, but exclusion, unfortunately, is a quite a big problem when it comes to healthcare, especially I'd say in the UK, to be honest. So that's exclusion. So we've covered discrimination, moved on to exclusion. Obviously, the exclusion itself can come under different terms and is very complex as well. But in a nutshell, I thought to share this one. So the next one, we have prejudice. And this is prejudging patients or carers based on their race, ethnicity, and this could lead to affecting the quality of care provided. And this means here, there's an example, a nurse assumes a patient from an immigrant background just won't follow medical advice because of preconceived notions about their culture. That nurse won't even perhaps try and learn, or maybe not trained in engaging with a patient due to their culture. And because of that, medical advice, they won't receive that medical advice, and in terms lead to health inequality. So it's really sad. But in a nutshell, this is forms of prejudice. There are many other forms of prejudice, but this is the one I've come across and chosen. We're going to go to the next one here, stereotyping. So again, making assumptions, and a lot of these things are this outright racism or bias, or making assumptions. We'll come to bias in a bit, but making assumptions about patients or carers based on their racial or ethnic background, which can lead to unfair treatment and misdiagnosis. And an example is a healthcare provider assumes a Hispanic patient is less likely to understand the medical terminology. Remember what I mentioned before about the jargon. So unfortunately, without assessing their actual knowledge or education level, that patient is going to suffer health inequality. The healthcare provider is just not going to bother or to speak that jargon, leaving that patient trying to work out what to do next, to be honest. This is a really difficult one, really. It requires training on both sides. I'm not going to give solutions as yet. That's another lecture for another day. But I think it's important those watching the video understand these things happen in healthcare settings, which lead to health inequalities, which again leads to tragedy, because those who are vulnerable will have the risk or will have years shaved off their life because of health inequality. It's like a cascade and waterfall. Just because someone in the healthcare profession made a judgment. So that's stereotyping. Move on to others. Cultural insensitivity. So failing to respect or understand the cultural needs and values of patients from different racial or ethnic backgrounds, leading to ineffective care. An example of this is a Muslim patient is scheduled for surgery during Ramadan, and the care team does not consider fasting practices when planning their care. So obviously the patient was in discussion regarding the surgery, and they just will not budge. The healthcare team won't budge. It's going to cause obviously distrust. The patient will feel insulted, and they would not really want to engage with those services. It's a form of cultural insensitivity. I'm not saying the healthcare team, should know straight away. Obviously, there needs to be training on this. A lot of this does involve training. We can't assume we can know everything about everyone's culture. That's not going to be possible. But with training, the outcomes would be a lot more improved. So that's a form of cultural insensitivity here. I think probably about 7 more. We've got inequality next. And this is a lack of fairness in healthcare access or treatment, often caused by systematic barriers and unequal resource distribution. This is a very difficult one to measure because it's not easy to tell when something's unequal unless there's been a serious breach, a serious incidences, too many of them, and that's when it begins to raise its ugly head. Let's give an example here. Obviously, rural healthcare clinics often serving Indigenous communities receive fewer resources and less funding, resulting into poor health outcomes. Again, this is not always easy to see. I mean, and what the problem might be is that you would need someone in those healthcare clinics to compare data. A lot of it is all about proof of data and why this is happening. But this is a good example of, inequality or inequity, sorry, when it comes to healthcare settings. So obviously, if they're receiving less funding, obviously it is going to affect the Indigenous communities because they're just not going to get the levels of service that they need compared to other healthcare clinics. Got here structural racism again. Yep, it's a difficult terminology, but it exists. And what do I mean by this one? The institutionalized policies and practices within healthcare systems that disproportionately disadvantage people of certain races and ethnicities. And this does happen. But let's have a look at an example. So a hospital system is built in a way that most advanced care facilities are located in affluent, predominantly white neighborhoods, making it harder, unfortunately, for minority communities to access high quality care. Yes, and this does happen. It doesn't have to be just down to, where the hospital system is built. It could be down to, as mentioned here, policies and practices. And data shows that minority groups are suffering because of that. And it might not be just outright racism. It might not be just that alone. It might be just down to the biases and assuming. And it's a complex one. I should have given more than one example. In fact, at some point I probably will do. This is a very tricky one that can creep into systems because people assume certain things. And I think that one of the best ones is we can feel to assume that this is only within the healthcare systems. It's not. It could be something that's driven, that's actually happened outside that healthcare system, but now has influenced it. So it could be down to where funding is going. Who's being given votes to make those decisions, a whole raft of things, education, not including minority communities to help in making decisions. So it's not just reduced into that healthcare system. There's things structural outside it that can affect this. That's a form of structural racism. There are many others. It's a quite unfortunate, quite a complex practice, but it does exist. Other things, inadequate representation, quite common. Underrepresented representation of racial and ethnic minorities in healthcare leadership, healthcare research, decision-making, which can affect service delivery. and patient outcomes. An example here is a medical conference about sickle cell disease, which obviously predominantly affects Black individuals. But when it comes to the panel of experts, that's fine. There's no Black healthcare professional on the panel. So it's not quite right here. So if you don't have those voices there, and there's decisions in research regards to sickle cell disease at this conference, how can you say this is going to lead to a good outcome straight away? It's not going to work. So this is inadequate representation, and it does happen. Continue on, we've got a few more left. So it's our first bias here, implicit bias. So unconscious. Now this is a very devastating form of terms, because we all have bias, even myself, we all have it. It's unconscious. So it's more of a habit, attitudes, what the media bangs on about, and that can lead to our decision making. Forms of stereotypes that affect healthcare providers' decisions, leading to disparities, and that's another term. I don't think I've included that. I'll have to cover more in the future in patient care. So a doctor unconsciously assumes an Asian patient is more likely to have certain health conditions based solely on their ethnicity, potentially overlooking other critical health issues. So it's a really tricky one, but unfortunately it does happen, and minority groups to pay the price. Could be down to a lot of training needed here. A lot of habits need to be reshaped. But this is a form of implicit bias, unconsciously assuming just because someone is from a certain background that the main cause of health situation is something else, and you overlook other health issues. Cultural incompetence. So healthcare providers, they lack the ability to effectively care for patients from diverse racial or ethnic backgrounds, often leading to suboptimal care. An example here is a healthcare provider does not understand the importance of extended family involvement in the care decisions of a Pacific Islander patient, causing miscommunication. As you notice, there's quite a few of these examples I'm giving regarding the focus on families and care. Obviously, it's me showing a bit of my bias regarding unpaid carers. But yes, it's cultural incompetence. They're not really including other family members here. And obviously both pay the price, the patient and their family. So yeah, miscommunication on that part. So what's the next one? Unequal treatment. So the sad one, this one, providing different levels of care or service based on race and ethnicity rather than individual needs. The example here is two patients with the same symptoms, but different racial backgrounds receive different levels of diagnostic testing and treatment options. This is unfortunately a sad practice that continues and needs a lot of focus in changing unequal treatment. This goes on. Bias, another bias terms, and it's one of the main ones. Unconscious against unconscious or conscious preferences that unfairly affect decision making, the unequal treatment. So in a nutshell, in a sentence, that's basically what it is. The example here is, again, with assumption, a physician assumes a patient on public health insurance, often associated with lower income minorities. They just want the patient just want to follow up care. So they're going to feel, because they don't feel they're going to follow up on care options, we're just going to give them fewer treatment options anyway. While the patient would be more than happy to follow up on healthcare support and scenarios that's provided, the healthcare options are provided. But the physician just assumes that, well, that's a poor patient with a lower income, and minorities often lower income. So therefore, why should we give them the full service? They're not going to follow it up. So that's your terms of bias, unconscious or conscious preferences that unfairly affect decision making, leading to unequal treatment, leading to unequal health, health inequity. So racial disparities, I've concluded that as the last one. The unequal treatment or outcomes for different racial or ethnic groups that often result in poor or health outcomes for marginalized groups. An example of this is Black women, and I've covered this in one of my other video lectures. They're significantly more likely to die from pregnancy-related complications than white women, despite similar health conditions. So what's gone wrong here? What's causing racial disparities as a form of unequal treatment? And the sad fact is people die because of those decisions. Racism, the biggest one, a belief or behavior that one race is superior to others, leading to discriminatory actions and outcomes in healthcare and beyond. So a hospital staff member dismisses or derogatory remarks about a patient's race, affecting their comfort and willingness to seek care. And if you look at the mental health situation, when it comes to stigma as well, mental health has its own stigma, you apply that with racism, you can imagine what's going to happen. Those from minority groups are just not going to engage regarding better health outcome because of poor experience. They've been unlucky to experience racism. And as I said, what makes it really more difficult is sometimes it can be unconscious. So in situations, so I was making dismissive remarks unconsciously when someone is going through or living through mental ill health. And because of that, because of the mental stigma and the racism stigma, it's a double blow. They're just not going to engage because they're vulnerable, in a vulnerable situation. They don't want to damage the mental health even more, and they don't know who to trust. So therefore, they're going to be hidden. And to make matters worse, they're going to receive poor health outcomes. So you can see this is just some of these terms that I'm mentioning that exist. A whole lot of work to do when it comes to health inequity terms, structural racism terms. They exist. People die from it. People suffer from it. And those who practice it think it doesn't affect them. It does. So there's a lot of work to do because a lot of this is unhidden. And if it chips away at healthcare, really, it chips away at society as well, and leads people to distrust each other. Hardly an example of a civilized community. So there's a lot of work to do. But anyway, enough of me prattling on. I just thought to mention these terms. So if you felt this video was useful, and I do hope you do, and leave stuff in the comments if you want, give it a like and feel free to share it. So I've been away for a while, I've been quite unwell. It's winter time and I caught the flu, but I thought to be back and share a bit of my knowledge, really. And I'd say thanks for stopping by, and no matter what background you come from, white, black, or whatever, look after yourself.